Ohio, Kentucky, and Indiana all set new records today for coronavirus cases.
And with a surge of hospitalizations, it's no secret frontline workers are getting exhausted both emotionally and physically. Local 12's Jenna Cisneros joining us now live from Bethesda North with what's being done to address this problem. Jenna, I can only imagine what these folks on the front line are going through.
And Kyle, here at TriHealth, they have a program for employees to use to help with stress and traumatic events. They say since COVID-19 has started, they've seen more people utilize this program. And earlier today, I spoke with a nurse who paints the picture of what it's like working on the front lines as COVID-19 cases continue to surge.
The demand that is required of nursing is just astronomical right now.
Ohio and Indiana are among 17 states with a record number of COVID patients in hospitals.
All of a sudden, over the past 4 weeks, we've jumped up to triple digits or triple numbers in COVID.
Nurses like Tyra Williams are feeling the extra stress as we enter month 9 of the pandemic, facing their greatest patient load yet.
Caring for those patients, and when I'm rounding out on the units and I'm looking at my nurses' faces and they're saying to me, Tyra, we're tired.
What we hear consistently is that their biggest challenge is having enough staffing.
To help with staffing challenges, Indiana State Department of Health is asking any licensed healthcare workers, including those who may be unemployed or retired, to volunteer to serve as a member of its healthcare reserve workforce. The goal is to help provide support or relief to those on the front lines of this pandemic.
They need our support now more than ever, both emotionally and physically.
And as the holidays approach, Williams wants to remind people of the basics.
We really have to hone back in on what we did very well back in March and April and May. We have to go back to doing that so we don't tax our hospitals and we're not taxing our healthcare system and our physicians and our nurses, because that's what we're feeling right now.
And in northern Kentucky, hospitalizations are also high, but the main difference between now and March is that they are much better prepared. They say they've not had any major COVID spread inside the hospital. PPE and cleaning supplies are stockpiled to help keep up with demand. And then testing capacity is more than 10 times what it was in the spring, as well as turnaround time is less than 24 hours. And they've also had less patients on ventilators because treatments have improved. For now, reporting live in Montgomery, Jenna Cisneros, Local 12 News.
Jenna, thank you. And here's a look at those record-breaking numbers from today around our region. Ohio reported another 4,961 cases in the past 24 hours. There were 33 new deaths, increasing the state's total to 5,461. Kentucky added 2,268 cases in the past day and 20 more deaths. The virus has killed at least 1,534 people there in the Commonwealth. Indiana had 4,462 new cases and 45 deaths to now reach 4,269 overall.